It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, everyone. This is Dr. Tammy Patzer, and I'm really excited for this episode of Optimal Health because we have Dr. Elra Morgan from St. Clair County Laser Pain Center with us today. And of course, he uses Relief Now laser methods. Let me tell you a little bit about Dr. Morgan. He is an honors graduate from Logan College of Chiropractic, and he has a master's degree in sports medicine and sports rehabilitation. And he regularly updates himself by going to classes, but he also teaches classes. And he is always on top of his health game. And recently, he's added Class 4 deep tissue laser to his practice. And today, we're going to take a deeper dive into laser medicine and learn more from Dr. Morgan. So thanks for coming today. How are you?
I'm doing excellent. Thanks for having me in, Sam.
Great. So before we get into the Class 4 laser information, tell me a little bit more about your background.
Well, I had a background with martial arts. And with martial arts, you get a lot of knick-knacky injuries and things that can interfere with your performance. So I was always trying to find the things that could improve and get better faster, recover faster, and stuff like that. So that kind of led me down the road to get me to where I am today. So since 1997, I've been dealing with alternative health and things that get people better without the use of drugs or injections and things like that. Our motto is kind of like skip the drugs and skip the scalpel, right? So we try to live up to that.
Well, that's what everybody wants. They want to find a way to get that pain relief without surgery and without using addictive drugs, because that's one of the biggest issues everyone faces today. So tell me a little bit, why did you decide to add Class 4 laser therapy to your practice?
Well, I do a lot of research, and reading through these research studies and papers, I saw the big effect on it. When I was in grad school, I got my first certification. So this is back in 2012, K-lasers were coming out. And they had a class for us. They talked about the importance of the photobiomodulation. They talked about the things on how the light could help heal the body. So at the time, I thought, I don't know a little bit about that. So I started digging more into the research, and I said, wow, this is really impressive. This is really effective. And what happens is that all the $1 million athletes, they get access to this stuff, and they have it every day, 2-3 times a day. And in my practice, I saw a lot of patients mimicking some of those same injuries. They just didn't get it being hit by another linebacker or something. They just got it when they slipped on some ice and fell and hit the ground, or when they picked up their grandkid. So I saw how effective it was for them. And I said, you know what? I'm going to bring this to my office, make it affordable so that the everyday person can actually have it for themselves. And it gets you better. It gets you faster. It is very impressive with the techniques that we're able to do with these Relief Now laser methods.
Wow. So tell me a little bit more of what can be treated by Class 4 laser therapy.
Well, that question is interesting because it's almost like it would be a shorter answer if I was to say what couldn't be treated by laser. There's several things, though, but what we focus on in our office are kind of like our big five. We treat a lot of neuropathy. We treat a lot of knee pain. We treat a lot of lower back pain, sciatica pain, like disc-related pain. And that's all kind of like one category there. Then we work a lot with shoulders and a lot with plantar fasciitis, because we get a lot of runners coming through here as well.
That's interesting when you said what it would be easier to answer what you can't treat with it. So can you just give us a little bit more detail about how laser therapy works on your body?
Sure. The way that the laser works, it actually penetrates through our skin, through our tissue, and it goes down to the cells. And it gives like a big power boost to the cells. So for example, if you had a regular car and you put rocket fuel inside of it, the car would go a lot faster, it would perform a lot better. So that's essentially what we're doing with the laser. And actually, I brought this here to show this here. So we take this here and we shine that light right into that area right there. That gets absorbed into that area. So that's how the laser effectively treats that knee. It goes in there, it speeds up the healing process because our body's always trying to heal on its own. So this gives it that extra energy jolt and that boost, and it's safe, non-invasive, it doesn't require any drugs or surgery, no injections.
So in the example that you just showed, you literally were shining a light. It looked like it was a knee, was
Yes.
a knee joint. So let's say that you have knee pain. What would the process be to determine if you were going to use laser on someone's knees? How would you determine that?
Well, first, we would have a consultation. We would sit down one-on-one and we'd go over the health history of what their chief complaint was. In this case, it would happen to be the knee. We'd get a detailed history about what happened to the knee. Was it a slip and fall? Was this an old sports injury? Did this just happen over time? Did you bang it when you got off a ladder? Did you hurt it when you played football back when you were a teenager? Have you had previous procedures done to it, ACL, meniscus injuries? Once we collect all that information, we go ahead and we do a treatment with the laser. We do a physical assessment, making sure that everything is stable. And then that's when the laser treatment comes in. The laser, because it's so safe, there's like no side effects for it. We can treat a person, and usually that day they notice a decrease in pain, an increase in range of motion, and sometimes muscle strength has returned as well. Now, with laser, it's a cumulative thing. So it's not one treatment fixes it, it's accumulation of treatments. And usually it's dose per decade. So we like to say if you're 10 years old, you'd have 10 treatments. If you were in your 60s, you'd have one treatment per decade. So that would be 6 treatments there.
Oh, that's interesting, because that actually was one of the questions I wanted to ask was how long can somebody expect to have it take? When you say, let's say a 60-year-old comes in and they have the knee issue, how you'd say it would be 6 treatments. How often should they go in for that laser treatment?
Well, in that initial 6 treatments, we're going to see them a minimum of 2 times a week, and we're going to see them a maximum of 3 times a week. It depends on their level of activity, because with laser, it's so important to understand that this is an outpatient procedure. So you don't have to be down, you don't have to miss work, you can do all your normal stuff while being under care. So it depends on how available a person is and how severe the problem is. If it's really severe, we're going to see them 3 times a week for 2 weeks. That's their 6 visits. That's getting them that 6 doses in there per decade. If it's a milder condition, we'll see them 2 times a week, and we'll carry that out over time.
So what that triggers in my mind is to say, okay, so I do my 6 treatments. How long can I expect the relief to last?
Well, with our 6 treatments, that's how we establish our baseline. Okay. So our miracle cases are done in 6 treatments. Some people need a little bit more. Some people are good right at 6. We do a reassessment on that 6th visit. And then that way we compare what we took on the first visit as far as the orthopedic test, neurological test, range of motion test, and we compared that to where you are on that 6th visit. So that way, that there's been a subjective change by the way you feel, but there's also an objective pain or change from the things that you felt before, whether it was pain, decreased range of motion, etc. And this allows the patient to know that what we're doing actually works, and it's not us just doing something to them to say, hey, it's getting better. We're not just giving them a pill, say we'll see you in 6 months and hopefully that goes away. We're involved with them. Their goal is our goal. So at the end of that 6, if a person says that they're 50% improved, okay, well, we can say, well, we'll follow that up with another 6 visits, and that should get you as close as we can to that 100%. Some people choose to go a little bit more than that because they'll find a separate area. You know what? My knee feels good now, but I got the sore foot or I got the sore ankle. And because the laser is how it is, once we finish up the initial area, we can transition right to another area.
Oh, so that's interesting. So laser treatment, pretty much you're only treating a certain area. You mentioned like neuropathy or plantar fasciitis also. So so I have my knee issue, but my hip also hurts. So that would actually be two different laser treatment areas, I take it.
That's correct. That's correct. Yeah, we want to get a proper dose into this particular area. So a person's chief complaint. One of the questions that I asked on the first visit is what can give you the biggest impact today? Because most people don't just have one complaint. Usually it's 2, 3, 4, 5 complaints in this day and time that we're living in. You know, back in the day, it used to be 1 or 2 problems, and now it's 6 or 7.
So you mentioned about one treatment or one dose per decade or something like that. So
Yeah.
Is there anyone who should not use lasers or who would not be a candidate for this type of therapy?
No, it's just about safe for everyone. You know, if you're doing active chemotherapy or something along those lines, you just had a pacemaker put in those, and we wouldn't be working on those areas. You see what I mean? So we would have those people get cleared by their medical physician, and then from there we would proceed with our procedures. But as far as orthopedic goes, knee replacements, back surgeries, and stuff like that, we can immediately begin treating things like that.
So that could actually speed up the healing process if you'd had, say, surgery on your knee or hip surgery or whatever that would be.
Exactly, because one of the benefits of laser is that it prevents scar tissue from forming. So I know we've all heard the horror stories of someone getting a surgery done in their lower back, and then 3 years later they had to go back because they had so much scar tissue it wrapped around the nerves. Well, lasers actually prevent that from happening. It helps arrange the collagen fibers in a proper formation so that they don't wrap around any nerves like that. It reduces that.
Wow, I didn't know that. So what type of studies have been done? I'm obviously science is backing this up, and they've done a lot of research on this. What have they found? What types of case studies have they done?
Well, it's been several case studies. And I mean, laser's been studied for the last 30 years. Okay. But I'll just talk specifically with one of the groups that I'm involved with. Last year, we saw 4,000 patients, and we collect our data into one database. With those 4,000 patients, our average level of improvement from beginning to the end of the program was 60%. But we had 90% of people talking about they had improved balance. We had 90% of the people talking about they had reduction in pain. We had 97% of the people talking about they had more range of motion. So all those are key factors that we need as we age. You know, our population is aging. Those are the people that are at risk for falls. Those are the people at risk for increased cases of neuropathy. Those are people that are increased cases for diabetes, which actually leads to neuropathy, or even cancers with the chemotherapy, which again would lead to neuropathy. So laser isn't a magic bullet, but it's the closest thing that we have to it.
Wow, that's really interesting because you mentioned about, did you say it was like in the 90% range of people improving their balance?
Yes.
And I know I personally have fallen down a few times in the last year, and it's crazy, you know, all of a sudden you just go boom, and you don't really know why, but that would be really a good thing to know, you know, that, hey, this could help your knee or your foot or your hip with this. So there's scientific background. What other types of therapies would you use in combination with laser in your practice?
In our practice, we combine laser with several other therapies, like non-surgical spinal decompression. So we do laser decompression. So that way the nerve is able to get stimulated when the disc is pressed on it. So I'll show you an example of that. When we have a nerve that's getting pushed like that with that disc right here, again, we just are able to shoot that laser right in that area right there. It reduces the inflammation around that area. And as we do the decompression, we get the pump mechanism working right again. And then that area is now fixed. And all the symptoms that are associated with it, the burning, the numbness, the tingling, things like that, go away. And it stays going unless you re-injure yourself. And that's the same thing like with neuropathy. We combine in whole body and lower body vibration, because if you can't feel your feet, you're going to have more falls. You're not going to be able to drive because you don't know which pedal you're pushing, the gas or the brake. So we have to reestablish the connection from the feet back to the brain. And we do that with the laser. We do that with the vibration. We're able to do that with the decompression. We also have other technology in here. For example, the Pro Balance 360. With that, we actually are able to get a stability baseline. So it lets you know how likely you are to have a fall or trip. Once we establish that baseline, right in that software, we're able to start rehabbing you right there to increase the levels that, so let's say if you got a C score, we're able to work on all the things you need to bring that C score up to a B, and then from a B to an A. It just takes time. Everyone needs to be patient with their body, but it's kind of, again, like that dose per decade. Once we've established a baseline and you set your goal for, let's say, that B plus, we can focus on that and we do everything we can to get you there because, again, your goal is our goal.
Wow, that's really interesting because I don't think a lot of people think about the fact that how at risk you may be for trips and falls. Like I never ever thought of myself personally of being somebody who would be at risk for that. Although, guess what? I have slipped and fallen. And of course, you hurt yourself and then you have to recover from that. And it takes time. So the laser therapy, am I hearing you right that you're saying that with laser therapy, it can help you to not only heal, but it can help you increase it so that your odds of falling and slipping go down?
That's exactly it. I got another little thing here for you. When we see our neuropathy patients, that's a normal nerve. This here is a nerve that's been affected. This is a nerve that's severely been affected. One of the things that a laser does is it vasodilates, so it's able to open those arteries up around those areas. Another thing that it does is nerve regeneration. So if you're walking in the door like this, we can regenerate that nerve up to here or even here in some cases. So once we have our baseline established, we go back and we do these tests. So we're testing a patient on the 8th visit, on the 12th visit, on the 16th visit. We're making sure that whatever their care plan is set up for, that we're achieving those goals that we've sat down and established in the beginning of care.
So in that image that you just showed, you actually can heal those nerves and bring them back up to a higher level with the laser therapy. Is that the image that I was seeing? Was that it looked like the nerve was all like skinny and tight, and then a healthy nerve is more fluffy and fuller?
Exactly. I'll use the diabetes example. So when a person has uncontrolled blood glucose, that in circulating in their body is kind of like an acid to the nerves. So the nerves get shocked, they get burned, they get tingling. And then that's the responses that you start to see as an individual. Loss of balance, the burning at night, feels like your feet are in the campfire. They call it a campfire effect. Next thing you know, you don't feel too steady on your feet, so you're using a cane. You're out in the yard, you step on something, don't know it, now you get infected. You go from that to using a walker, and then you go from there to maybe they have to cut off a body part. And we know if they start cutting, you only have 3 to 5 years left to live, pretty much. So what the laser does is it gives people the opportunity to come in and see for themselves. And like I said earlier, it's not about us doing something to them and them saying, and us saying that, hey, you're getting better. It's them saying, wow, I noticed the difference with this. I want to go ahead and get this program so I can see how good I can get, so I can now cross off all those things over here that could possibly be the future. And I want to choose the other future, the better future for me, my family, for my grandkids, etc.
Wow, that's interesting. I didn't know that, that once they start removing body parts, that your life expectancy goes down so much. So it kind of makes sense to look into it to see if this laser therapy could be of benefit to you. So if somebody wants to get in contact with you for a consultation, how do they do that?
Well, the best way is the most direct way. They can call us on the phone at area code 810-420-0801. They could also go to our website, and we're St. Clair County Laser Pain Center and .com, so they can find us online if they want to peruse through our website. On there, we have dozens of testimonials. We have videos of patients that receive treatment. So we have pre, we have post. We have all kind of information for people. We have the research studies there. If they want to take it to their MD or their DO or their family care practitioner, they can do all that. They can share that information, because in actuality, by them sharing that information with those other providers is actually making our community healthier, because those providers will now know where to refer some of those patients to, because they see a lot of it and they know that the solutions that they have aren't really solutions. They're just kind of cover-ups. Laser, well wave therapy are two of the only things that we have right now that actually fixes and heals the body. And I would even add decompression in there too, specifically for the disc. Those are treatment therapies and modalities that actually fix and heal the body. It doesn't just cover them up. It doesn't just treat the symptoms. It actually gets to the cause of the problem and it corrects the problem.
Wow. I just had another idea, a thought that I forgot to ask you, and that is, can people come and to see you even if they don't live in St. Clair County? Can they come in and be your patient even if they're from someplace else?
They can. Actually, where I'm located in Marine City, Michigan, which is in St. Clair County. I have several patients that come over from Macomb County, from Wayne County. Now, these are places that are 45 minutes, hour and a half away from my office. We even have some international patients that come over from Canada. We have a bridge that's about 40 minutes north of us. They hop on the bridge, come down, get a couple treatments, go back. Some people, because of the distance, will do what old school doctors used to do. They come in and get a treatment in the morning, they go out, they have lunch, go do some shopping, and they come back and they get a treatment in the afternoon. They're able to go back home. Later in the week, they come back. And so in that way, we're able to take the treatment and compress time by increasing the dosage per day, but they didn't have to make all the extra travel trips and arrangements. We've had some people come in, though, and they stayed in a little hotel downtown, and we treated them over the course of a couple of weeks. So we have that information on our website, too, for our international patients that may want to fly in. And then, again, like I mentioned, we're in St. Clair County, but we see people that come in from Macomb, from Wayne, and St. Clair, obviously.
Okay, great. Can you go ahead and repeat your phone number and website again for us?
Yeah, so the website, we can be found at St. Clair County LaserPainCenter.com. Okay, and then our phone number is area code 810-420-0801. Again, that number is 810-420-0801.
Great. Is there anything you'd like to add before I let you go?
Well, I just want to let people know that there's an opportunity for them to get help. Help is right around the corner. I'm in a small town, so I like to say you can come here and get the big city care with the small town touch. So if you have any of these problems that we talked about, whether it's shoulder, knee, back, disc, come on in here. We'll tell you if we can help. We'll sit down, we'll listen to your story. And if we can't help you, we're going to do exactly that. And if we can't, we'll tell you that too and get you in touch with someone who actually can. And the reason we can do that is, again, your goal is our goal. And when you talk, we listen.
Well, great. I really appreciate it. Everyone, we've been speaking with Dr. Elra Morgan, and this is Dr. Tammy Patzer with Optimal Health, sponsored by Relief Now Laser Methods.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit OptimalHealthRadio.com.